I'm Phyllis from Reno, Nevada, and I have had a very positive experience with Vein Nevada and Dr. Franciosa. Everyone from the receptionist as I entered the practice was very courteous, very polite, very respectful, and I was made to feel welcome as a patient. For quite a few years, I'd been noticing that I had sort of an ugly bulging vein in my left leg. So I had to see my dermatologist later on that year, and she commented on it, and I said, yes, I know, I don't like the way it looks, but I guess I'm just stuck with it. And she said, oh no, there's a procedure now that can be done, and it's not very painful, and these can be taken care of. And I said, oh. So she directed me to Vein Nevada. And I made an appointment and I came to Vein Nevada and was told of this procedure and how it was very little pain and discomfort. And from that point on, I started treatment. They did an ultrasound of both legs, front and back, just checking, making sure there were no blood clots. And after I got a clean bill of health there, then we began to make appointments to have the procedures done. I made the decision to have the VenaCell procedure, which will close off the veins, and made my appointments with the staff and came in and went through the 4 consecutive days. The pain was very minimal, and Dr. Franciosa would talk all the way through, and he would explain everything he did as he did it, so there were no surprises.
VenaSeal is the latest and greatest that we have to offer patients. It is the newest technique. It's called a non-thermal, non-tumescent technique because unlike the radiofrequency ablation, we don't have to give local numbing inside the leg because what we're actually doing is we're gluing the vein shut. So those valves are still malfunctioning, the vein is still leaking. All we're going to do is we're going to access the vein down around the knee, we're going to put a catheter up into the vein, then we're going to inject medical adhesive, and we're going to glue that vein shut so that the vein can no longer leak. The goal of the procedure is the same. You want to stop the leaking down the vein, and therefore the glue will do that because the vein will be glued shut, and there's no worries about any more symptoms from the patient having had those bad valves.
The restless leg symptoms I was having have totally disappeared, and the bulging vein is just about totally gone, so I'm very pleased with that. My experience here has been totally informative and, very appreciated to learn everything I have.